These patients represent about 15% of all patients treated with thrombectomy, so they are a large group of patients, and they are very particular due to individual characteristics of the tandem lesion itself and of the treatments that the tandem lesion will require. So it's possible that the treatments that work for the general population might not work as well or differently for the patients with tandem lesions. And we are particularly interested in the effect of intravenous thrombolysis for patients that could directly receive endovascular treatment, because it remains unclear if for these patients a combination of both treatments is superior to just doing the thrombectomy right away. We actually investigated these results in the IRIS collaboration, which is an individual participant data meta-analysis including more than 2,000 patients in 6 randomized clinical trials from more than 15 countries in 190 centers. In all of these trials we had patients with carotid tandem lesions, and all of these patients were presented directly to centers that could do the thrombectomy right away. So we identified if the effect of the combination of intravenous thrombolysis and then the thrombectomy versus the thrombectomy alone was different in patients with and without tandem lesions. But we did not see that the presence of the tandem lesion alone modified the effect of intravenous thrombolysis. What we did see, what was quite interesting, was the effect of acute stenting, because that is another point. Just having the tandem lesions does not tell you much, because many things happen to these patients, and a very important thing that can happen is that it can be decided to treat the tandem lesion during the endovascular treatment with angioplasty or placing a stenting, and if that happens, additional medication are necessary, additional antiplatelets are necessary, which could mean that intravenous thrombolysis could cause more bleeding, which we do observe in our data, although not statistically significant. But the effect of acute stenting actually led to better functional outcomes in these patients. Even if they had received intravenous thrombolysis and had a higher rate of bleeding, the benefit of the stenting was still preserved in this population.